welcome to the Preemie Chats, and thank you all for joining us here today. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF. And to co-host this live session with me today is Leah Whitehead, journalist and Preemie parent, joining us live from Halifax. Hi, Leah.
Hi, Fabiana.
And CPBF is a charitable organization, and our mission is to empower families of premature babies through support and education. This Preemie Chat series is one of the many initiatives we have to bring information for NICU families and healthcare professionals. Here every Friday, we talk with experts, researchers, and parents who share with us their knowledge and experience. Also on our website, canadianpreemies.org, parents will find all kinds of resources and support. And one of them is the Parent Care Program. We are offering 4 free therapy sessions for families who are currently in the ICU and up to 3 years post-discharge. To get more information, you can visit our website, canadianpreemies.org.
Thank you for joining us for this special Preemie Chat today, where we are acknowledging International Kangaroo Care Day, which happens on May 15th. Now, in recent years, Kangaroo Care has been recognized for the medical intervention that it is. It improves the physical condition of babies, but we also know there's something much deeper that takes place. It improves the emotional and mental well-being of both the parent and baby engaging in this kind of specialty care. Now, I want you to take a look at this beautiful graphic. This is an infographic that CPBF is launching today, and we want to start by thanking Water Wipes for their unrestricted grant to create this educational tool and resources. Kangaroo Care is essential for NICU families, and we're going to talk about that lots today. But I also want you to take a look at CPBF's website. They have a special section dedicated to Kangaroo Care, and this infographic here is available for free download. You can share it in your NICU, as well as some great resources that you can use to participate in this special day on May 15th. This Kangaroo Care Preemie Chat session, we're going to talk about education for families and staff. We're going to talk about Kangaroula, which is an emerging field of doula care. And we will hear from parents highlighting their experiences in NICU, a cis queer person perspective, a mom who was in NICU during lockdown, and a father who spent 258 days in hospital.
Wow. And today I have the honor actually to bring here live from Winnipeg, our first guest speaker, Doris Dickson. She'll give a brief review of the benefits of kangaroo or skin-to-skin care for premature babies and their parents. She'll talk about her experience in the ICU and give some tips to provide skin-to-skin contact with sick infants in the ICU. Doris worked as a neonatal nurse, clinical nurse specialist, and lactation consultant in Winnipeg for over 30 years. Doris has a passion for parents of sick and vulnerable infants. She's now retired-ish and works as a nursing consultant and as a clinical education facilitator for the University of Manitoba College of Nursing. She's also the chair of the board of the Canadian Premature Babies Foundation. Doris, thank you so much for joining us here today. It's such an honor to have you here sharing your passion, your knowledge, and expertise with us.
Thanks very much for having me on this. I think this is my first time on Preemie Chats. And so I'm really happy to be here, and I don't want to waste any time talking about me. So let's jump into Kangaroo Care. Totally one of my favorite topics to talk about with nurses, with parents, because it's just probably one of the things that revolutionized the way that we managed newborns, tiny babies, in a way that didn't involve drugs or machines. And it was something that suddenly parents could give, other than breast milk, which is my second favorite topic. So first, most important thing is to note that skin to skin kangaroo care is not just holding your baby while naked. And I really saw so many parents, as soon as the baby would come off the ventilator, they'd hold them bundled, or as soon as the baby was big enough to wear clothes, they'd hold them bundled, and really sometimes had to be encouraged to undress the baby. So step one is the baby needs to be naked at least from the waist up. It's not just touching their skin. And we'll talk a little bit more about the sickest babies, but it's got to be ventral skin to skin contact. So I'm starting with the technical stuff, and then the really good stuff will follow. But here's a really important thing, and I think that this helps people to motivate, is that there are these tiny lanugo hairs on the infant's chest, and believe it or not, on the adult chest. You've got nerve endings, and these stay for your whole life. It leads directly to the limbic system. That's the feel-good system in your brain. And the important thing about that is that this is why we love to hug. Hugging stimulates those nerve endings, and you've got to stimulate them to get that feel-good. That feel-good feeling, that positive, those endorphins and all those things. And I won't go into all of that, what's in the limbic system. You can look it up if you really want to know, but it's that fabulous system built into our brains. So the oxytocin and the cortisol effects are the most important parts of the limbic system that's stimulated. And you can get an increase of 65% of oxytocin in the newborn. And unfortunately, some of the symbols on my slides don't translate well when you move them over, but it's an increase in oxytocin, increases sleep, decreases stress, decreases pain. And so this is why we get these beautiful effects of really putting a baby into la la land, is how I describe it. It takes 1 hour of skin to skin to trigger all the hormones. That doesn't mean, though, and I always emphasize this with nursing staff, just because it takes a full hour doesn't mean if a baby or a mom doesn't have a whole hour that you're not going to get good effects. So just know that you get the full effect in an hour, but any amount of skin to skin is worth no amount. And there are 10 different hormones that are triggered for mothers. So that's why the baby and the mom really do this together, for mom to recover from delivery and for baby to really get all the positive effects, which I'm going to go into next. First, temperature. Normal infant temperature, 37.5. The maternal breast temperature automatically adjusts to the infant. And they really found this in studies with twins. If you have one twin that's warm and one twin that's cold, and I'll talk a little bit more about that, that's where they've learned how the mom actually automatically adjusts. And we call this in nursing a servo control. The mother is a servo control. The baby will not rise higher than 37.5 degrees on mom. And it's because of the oxytocin that causes this peripheral vasodilation. So 37.5. Now, some babies will normally be kept at between 36.5 and 37 in an incubator, so they'll warm up a little bit. The father, on the other hand, doesn't have that same oxytocin. After about 2 hours, they're cooking. So you will notice this with dads. They get kind of uncomfortable. The dad starts getting sweaty. The baby starts getting sweaty because after about 2 hours, the baby will get a little bit too warm on dad. So back to twins. First of all, if they do Kangaroo Care 3 or more times by themselves, they're going to get a little territorial, and it's going to take a little while to kind of accustomize them to doing it together. So you've got to be mindful of that when you've got twins that are sick. And then when they start doing it together, you might want to do short periods of time or have a short overlap time. So you do one twin, bring the other twin in for about 10 minutes, and then move the other one off. A bit of a extra time for mom, but it gets over this territorial idea these babies have. But interestingly is that mom's chest can thermoregulate them separately. If one is cold, they warm it up. And if one is warm, they actually cool it down. So you have a baby who's sort of overcooked on an incubator for whatever reason, mom will actually bring that baby to the correct temperature. Recommendation about twins especially is that you kind of don't do them together until there's no lines where they can maybe wrap their little fingers around them and pull out IVs and stuff like that. And you don't want them to cross-contaminate any sterile lines or things like that. So digestion and immunity, these are things that we don't always think about as Kangaroo Care benefits. The tactile stimulation, the taste really increases baby's peristalsis. The smell, the olfactory stimulation also stimulates the baby's limbic system. One of the things that I talk about skin to skin, and oftentimes this is the beginning of breastfeeding, because you can just take a baby and skin to skin, slide them down to the breast, and there's secretions around the mom's areola that have the same chemical makeup as amniotic fluid. So this baby actually feels like they've come back home when they go onto mom's chest. Very, very important thing that you do in the delivery room is where I now teach students putting the baby on mom's chest for the first hour so that it's a really good transition into life in the outside world. The gram-positive microbes, those are the good ones, and mom is transferring those to the baby. Just have the baby rub their hand on mom's breast and then stick it in their mouth and let them suck their own fingers, and you're introducing really positive microbes into the baby's digestive system. And the immune globulins actually transfer through the skin. Baby's got such thin skin that those immune globulins can actually be transferred directly through. And a lot of these slides I got from Susie Ludington, who's a worldwide expert in Kangaroo Care. Neurodevelopmental effects, and I'll try to go a little bit more quickly. I don't want to take time from the other speakers. But what we see, and this is really linked to sleep, is that the brain grows 250,000 new cells every minute. You want that baby to grow them in the best possible environment. What grows depends on what's being stimulated. So if you stimulate pain, the pain sensors, the pain areas grow. If you stimulate positive touch, then positive areas of the brain grow. And if you do too much light stimulation, you can actually, believe it or not, this is a fun fact, can interfere with hearing development. Now sleep, and this is the best part of skin to skin, is that the cycling of sleep is completely different in an incubator where sleep is chaotic versus in skin to skin where sleep is cycled and really calm. And they have the same number of positive sleep cycles in 2 hours of Kangaroo Care as they do in 22 hours in the incubator. And I'm going to show you this sleep pattern. So you can see this healthy sleep pattern where you get REM, non-REM. And now I'm going to show you the differences in skin to skin. So in an incubator, this is the pattern of sleep. It's absolutely chaotic. They do not get really nice cycled sleep in an incubator. Whereas in Kangaroo Care, and again, these are studies done by Susie Ludington, you get these beautiful sleep cycles. And during those good sleep cycles, you don't get negative changes in the baby's vital signs. This is a Dutch study, really premature babies, looked at them on ventilators. I'm going to look at this really quickly for the professionals in the room, is that you can see that blood pressure came down and stayed down. Respiratory rate, a heart rate came down, stayed down. Blood pressure, goes up. And these are babies who can be very hypotensive. So oxygen saturations actually come up, stay up. And then respiratory rate settles down and stays a little bit lower than it was before. So really shows that it is safe and beneficial for very small babies who are on ventilators. Problem with the really sick babies in the very early days when the baby is too sick to move. So how do you know baby's too sick for Kangaroo Care? Basically, the criteria that we would use in our NICU was that if the baby shows signs of stress when moving, well, how do you know that that's going to happen? So you start by looking at, does the baby show signs of stress when they're having a diaper change, when you're changing the bed? If you can't bath them because of their stress signs, they might be too fragile to move. So in those cases, you've got to find other ways to stimulate those fine lanugo hairs. So if the baby is prone, you can actually access, and they do have on the back of their shoulders very similar nerve endings, so that if you lay your hand over top of their shoulders, and you see the mom in the top who's kind of doing a hug hold while in the bed. Mom kind of can lean over, and sometimes you can get the parent to go actually skin to skin with the baby staying on the bed. So be really creative in how you can bring mom to baby instead of baby to mom. And when doing the transfer, you can do the same. Instead of having the flying prem through the air, have the mom lean over, put the baby on mom's chest, and then have the mom sit back into their chair. So there are ways that you can provide that for those sick babies. And in my experience in the NICU, and I remember the first time I helped a baby on a ventilator, getting into skin to skin, and we're talking about 1991 or so. If the baby can tolerate the transfer, and many times I've seen nurses who were reluctant, and when they've had a really good experience showing a baby's vital signs stabilize while in skin to skin, they become advocates. Respiratory therapists, really important when you're moving a baby on a ventilator. And you know, and the moms are going to talk about how that's the best part of their day. So I'm going to stop there, and we can move on to the next speaker, and I'm open to questions, and I'm happy to share resources if anyone wants to contact me later.
Hi, Doris, thank you so much for your presentation. It's always very important to highlight the benefits of Kangaroo Care for all parents in the ICU. I think my first question to you is the price of Kangaroo Care during painful procedures, because we know in a lot of NICU hospitals do a lot of procedures with baby in Kangaroo Care position, but it's not a common practice here in Canada. So how can we start having this conversation to have some of those painful procedures in Kangaroo Care?
Well, we know that pain, the pain perception is significantly reduced when the baby's in Kangaroo Care. So for me, the way that I've encouraged it is to get to the policies and procedures in the hospitals. So for instance, and because I wrote most of the policies and procedures around newborns in our hospital, then we wrote it into there to say that, for instance, in the first hour of life, when you need to give a baby vitamin K, you do it while the baby's in skin to skin. You encourage those newborn procedures that have to happen in the first day, but have to collect blood, that be done in skin to skin. So you have to plan a little bit, because you can't just put a baby in skin to skin and then do the blood work. You've got to have that baby in skin to skin for about 10-15 minutes first. So whether it's, and I appreciate the comment that was made, whoever the individual is who's providing skin to skin, the pain, the mitigation of pain perception can happen. So plan ahead so that the parent knows that this procedure is happening, and just have that as part of the routines, that babies go into skin to skin before the lab person comes, or whoever it is that's doing the potentially painful procedure.
Okay, that's wonderful, Doris. Thank you. I know you're going to stay with us for more Q&A. So we are going to move on with our next speaker, but Doris, we will be back for the next Q&A. Thank you.
Our next guest is Laila Adam, and she is the mother of Farah. Farah was born at 30-1 in July 2021. Farah spent 6 weeks in the NICU at both Foothills Medical and Peter Lougheed Center in Calgary, Alberta. The challenges faced by NICU parents, so many of us know, they were complicated by the pandemic. And that really struck a chord with Laila, because she was there at that time. And so since their discharge, Laila has tried to advocate for parents and families in Calgary through a volunteer role with the Calgary Health Foundation. and their fundraising efforts for the Newborn Needs campaign. She recognized that the time spent with Farah in Skin to Skin Kangaroo Care became beneficial for both her, Farah, and Farah's dad, Jesse. Laila, Farah, and her husband, Jesse, currently reside in Calgary, Alberta, and Farah is celebrating her 10-month birthday today, May 6th. So happy 10-month to Farah, and thank you for joining us, Laila.
Thank you, Leah. It's great to be here. I've been listening to these preemie chats actually since my time in the NICU last July. One of our nurses had recommended them. So it's very surreal to now be on here for sure. So thanks so much for having me. And yeah, I'll just pull up my slides here. Cool. So I just wanted to give a little bit of background to our story and say hi to all the NICU parents out there, those who are out of the NICU and both in the NICU. I really feel like we are connected to each other from far and wide. It's something about sharing our stories that brings us closer. So I'd like to say a special hi to all of them. But our daughter, Farah Gabrielle, was born on July 6, 2021. So yes, she is 10 months old today and currently out for a walk with her grandma. Farah was born at 30 and 1. My pregnancy was relatively normal. I'd actually had an ultrasound and seen the OB earlier that week prior to my water breaking. Farah arrived due to pre-prom. So she was born at Foothills NICU, which is a level 2 NICU here in Calgary, and spent 2 weeks there. And at 32 weeks was moved over to the Peter Lougheed Center, which was a level 3 NICU, and discharged at 36 and 0. So there's Farah on her second day of life. So when Farah was first born, we were at Foothills. We were as a result of the pandemic, Foothills is an open NICU. So all the families are in pods, but because of the pandemic, they had built what they called isolation rooms for newly born babies that were in that critical state. And they were literally built out of corrugated plastic and tiny little rooms that basically had a small nursing station along with a chair for the parents and then the incubator. You could still hear everything that was going on, but the idea was that this space was a little bit more isolated, given that the NICU shared a floor with maternity and delivery, and there had been a few outbreaks of COVID in the hospital. They did keep the babies there until they were a little bit more stable before kind of moving them in to the open pod area. Obviously, given Farah's age and gestation, we weren't permitted to do Kangaroo Care until July 8th, which was 2 days later, and wanted to share these pictures. This was both of our first experience with Kangaroo Care. Try not to get emotional, but I think this was probably the best day of my life, and I know my husband's as well. And the connection that I felt in that moment and the love that I felt, I don't think that I will ever be able to have that feeling back again, but it definitely benefited after such a traumatic arrival and kind of started us on the healing process as a family. After that, we were lucky enough that we only live, I think it was a 7-minute drive from the hospital. So after I was discharged, I committed to going to the hospital every day. And as a result, Farah spent somewhere between 8 to 12 hours in skin to skin, as long as they permitted me to do so. Obviously, in the first week, while she was still under the bright lights and tanning lights, we were only permitted about 1 to 2 hours a day. And either I would do that or my husband would do that time. But after that, I would arrive around 7:30 or 8, and Farah and I would have our time. I specifically, for me, enjoyed the skin to skin during rounds. So when the medical team started coming through the NICU, I found that experience in the beginning quite overwhelming. And obviously, some of the terms and acronyms that, are second nature to us all are all brand new, and not kind of understanding the medical system and terminology and what they're talking about. I really held her close during that time, and I felt the experience kind of a little bit more calming as a result of having her there and knowing that I was providing the best support for her. So these are just a few pictures of us during that time at Foothills. You can see we're kind of in a curtained off pod, and we're required to wear masks the entire time in those open pods as a result of the pandemic. So just a little bit more about our experience and the benefits that I saw. And I know Doris did a really great job of explaining the medical benefits and the research that's there. But what made it easy for me to sit there, all day is, first of all, there's no place, of course, that we'd rather be. But we had great support from our medical team and Farah's primary doctors, who had from the beginning shared some of the background and research around kangaroo care and skin to skin and those benefits. It also, I think, strengthened the bond between myself and the medical team, because there were conversations that we were able to have. And some of the procedures that you mentioned, Doris, about, I was able to hold Farah skin to skin either right before, right after, or even during some of the initial ones, to kind of keep both of us, I think, calm. And having that support of the medical team and encouraging it, never turning me down in a time that I wanted to take her and hold her close, was really, really important. The whole experience helped both my husband and I gain a further understanding of the NICU and the NICU environment, and the different teams that were there to support us. I felt way more empowered being there and kind of getting to know my daughter. I felt like I became a bigger advocate for her, and as a result was able to ensure kind of the earliest possible safe discharge for her being there, and just getting to know each other closely. I'm sure a lot of other parents feel this way. When entering the NICU, you suddenly lose all control of something that you probably had false control over to begin with, your pregnancy. But definitely for me, it became the one thing that I could control, was how much time I was going to spend with her and how close she would be with me during the day. And I would say for me with Kangaroo Care, it was something that I felt I was giving a little to, but gaining so much back, just in terms of, the hormonal physical benefits and milk production, but also kind of the emotional benefit kind of post-trauma of the initial kind of early arrival and premature arrival of Farah. I felt like it really did set us up on a proper healing journey. And we kind of figured out a schedule where, I would go in the morning and I would hold her in skin to skin. I would then go for lunch or take a little break, and then come back and do it for the afternoon. My husband would arrive from work around 4 or 5 o'clock, and then he would do a shift. And then often I would do a little bit more skin to skin and then pump before I left for the evening. And I think having the support of the nurses and the medical team to ensure that we could do that much time with her really, really benefited us. And I know, and Doris, you mentioned this too, it was not only a benefit for us, but for the nurses as well, right? So they had me there and knew that I was there with her and holding her safe, and that they were able to kind of complete some of their other duties or tend to other things that they had going on. I know I speak for both myself and my husband when we talk about the experience that we completely believe that skin to skin and Kangaroo Care was was instrumental in getting Farah home at 36 weeks. It allowed us to bond as a family unit, both to have these special experiences with her and make our transition to home, I think, a little bit more easier. So this is right before Farah was getting ready to go home. This picture, you can kind of see the happiness. This is just the day before. I wanted to share, this was one of our nurses. So one of our primary nurses had actually completed her master's in Kangaroo Care. And I think it's just kind of an interesting kind of anecdote, but my husband's an engineer. And so oftentimes he'd use things kind of in a little bit more technical terms. And she had created this pamphlet as part of her master's project or dissertation. And shared it with us, and it really helped click in for him, both the benefits of spending that time and kind of Doris, as you mentioned, he would do his shift and then they would both get too hot and then I would take back over. But just to kind of have those resources available in the hospital that explained kind of, not only the emotional, but the physical and medical benefits, I think was really instrumental in getting him kind of on board with, ensuring he was there at a time every day, and he had those couple hours with her, and just continued to strengthen their bond. And as you can see on this pamphlet, there's a bottom one there that says become a Kangaroo Care champion. And I am by no means a medical expert, but I really feel like after reading that and going through this experience, I try to advocate the benefits to not only preemie parents, but all parents for both mom and dad. So just a little bit of a follow-up. We were discharged on August 16th, which was also one of the best days of our lives. So here's Farah leaving the hospital. And I don't know if you can tell, but it was a really smoky day in Calgary with the forest fires. So we were a little bit nervous leaving the NICU and kind of the safe, sterile environment with our preemie. But what that kind of meant kind of post-pandemic was that like our visitors at home were limited. We didn't have, at that time, Alberta was kind of in this, I think kind of the worst phase of, or the worst wave of the COVID-19 pandemic that we saw last fall. So we didn't have a lot of people coming over to see the baby or to help us. So we decided to continue Kangaroo Care at home for about 3 hours a day. So plus contact naps, obviously, during that phase. But we kind of had a discussion that we would continue that through the 4th trimester as we healed both emotionally and physically, kind of as a family, just to ensure that we still had that safe bond with her, because we weren't getting kind of a ton of help or a ton of people, coming by to visit her that way. So it really helped us kind of navigate that that kind of, I guess, 4th trimester and just kind of that phase of the pandemic where we weren't able to see as many people that way. So, just a side note, we kind of, one of our nurses made this joke that, Farah came on July 6th and she heard in Alberta it was going to be the best summer ever. And just like the rest of us, she was disappointed. So we were just glad to have her home as early as we did. So as Leah mentioned, Farah is now 10 months actual today, 8 months adjusted. She is doing really well. We have been to the neonatal follow-up clinic. We're actually going again next week. Farah's been on an airplane. We're trying to live our best pandemic or post-pandemic life and kind of integrate back into everything. And I think just our experience in Skin to Skin and Kangaroo Care allowed us to really, really learn to get to know our daughter much quicker, advocate for her, and provide both physical and medical benefits for her. And, obviously there was no research done specifically on Farah, but, I saw the benefits of her in terms of regulating her breathing. She was out of the isolate in less than 2 weeks. Her weight gain's been phenomenal, and I just can't say enough positive things about it, and feel for all the parents still in the hospital and are, not able to do the max amount of Kangaroo Care that we were during that time, because I think it is really critical and integral to our kids growing up to be healthy and strong, and that bond that we have. So I think that's all that I have to share with you. If there's any questions, please let me know. I'm happy to chat. And like Leah mentioned, I'm now volunteering with the Calgary Health Foundation in the Newborn Needs campaign, which part of that campaign is to raise money to fully renovate the Foothills NICU, which is the only level 3 NICU in Southern Alberta and covers off Southern BC as well. And it's really critically important, I think, that we have some of those private spaces so that parents can room in, and that the pods are renovated so that we can encourage an environment where Skin to Skin is more encouraged. Peter Lougheed is the newest NICU in Calgary and does have private rooms for parents. And I think it makes it much easier when people have that privacy to have that time together. So thank you very much, everybody.
Thank you so much, Laila, for sharing that. And my goodness, it does our hearts good to see those pictures of your beautiful baby and how she's growing. And yeah, as you know, we are big on peer support with Canadian Premature Babies Foundation, and what you went through is no small feat, not only NICU, but NICU during a pandemic. So I'm just wondering what advice you would have for parents who are in NICU at this difficult time.
Yeah, I think that's actually a really good question. And I think, especially in terms of peer-to-peer. So, this experience, one, living during a pandemic, and two, having a premature baby, it's very unique, right? It's not something that a lot of people experience. So, really getting to know the parents in your hospital setting that are there while you were there, as well as I know a lot of hospitals have local peer support programs, which I was a part of at Foothills. They didn't actually have one at PLC, but we're actually hoping to start one. I'm going to talk to the neonatal follow-up doctor next week that runs at PLC about that. But getting to know the other parents and reaching out for support and just talking about that shared experience. So with Farah, we still keep in touch with a couple of her, I like to call them roommates, like her first roommates that she shared the pod with, and those parents, and both the moms and dads and other significant care or primary caregivers. We just, exchange text messages and things and talk about that experience and what it was like, right? Being in a room that was corrugated plastic, right, with your baby, trying to fathom what was going on, being told to wear a mask 24 hours a day while you were there, right? Just talking about that experience is really important.
That is wonderful. Laila, I have one question for you, because you know all the benefits of Kangaroo Care, all the benefits of Kangaroo Care. How important was for you to receive information about Kangaroo Care, and how would that help you to cope with the NICU, to bond with your daughter? But also, were you overwhelmed with the amount of information you received?
Not specifically to Kangaroo Care. There wasn't a ton of, kind of resources like those pamphlets that were there. Like I mentioned, for me, I obviously lead with my emotions first. And so what kind of sold me on Kangaroo Care was one of Farah's primary nurses, a different one than the one I mentioned, talking about Kangaroo Care in developing countries. Right. And that's often how preemie babies, that's their isolate, that's their incubator. They just line up and do Kangaroo Care with their mothers. And I thought, like, that's one thing that I can do to help Farah right now, because that's all I have control over. So, there wasn't a ton of information. And then, luckily for my husband, who, thinks a little bit more logically, and that way that pamphlet was available. And I think having more resources and benefits, and having the medical teams talk about those benefits directly, with the parents. And, I think maybe Doris might have a better idea, but I know in Farah's chart, they would have a line, how many hours spent in Kangaroo Care, right, per day. And I think, letting parents know that and the importance of it and really what the benefits are, would really help. So I'm excited for the infographic that you guys created. It's great. And I think will benefit a lot of people.
Thank you. We actually have a contest right now. We're asking parents and NICU professors to share their pictures with us, of holding baby Kangaroo Care, or some hospitals, doctors dress up as kangaroo. So we're very excited for this contest, and we're going to announce the winners on May 20, I think May 20th or somewhere around there. So we're very excited to receive those photos. But Laila, thank you so much for joining us here today. I will bring Doris back, because we do have a question from a parent who has joined us. Kessa, she said, I would like to ask one question. If I have to put one baby in Kangaroo Care, what are the precautions to be implemented regarding infection control? I mean, shall mom have a bath? That's a great question. Thank you for asking.
Yeah, that's a really good question. So I want to start by talking about the microbiome. The family or the individuals that live in the same household share the same organisms. And so generally those organisms are not harmful to you. And you've got antibodies to those organisms in your body. So the birthing mother shares those organisms to the fetus. So this baby is born in a sort of ready for that environment. So mom's body is really mom's body, dad's body, anybody from that household, their body is already part of that baby's environment. So you don't want mom to scrub it all off, or dad, or whoever's doing Kangaroo Care. You don't want them to scrub it all off before they put the baby there. They want to introduce that baby into that household. So unless you have an active infection, that would be a different story, and you have to deal with that with your caregivers. But for the most part, envelop that baby into the microbiome of the household, and it will be much healthier. And then if they're getting breast milk, even better, because those antibodies are in the breast milk. So Kangaroo Care and breastfeeding just go so closely together. So I hope that answers your question.
Thank you, Doris. And thank you, Laila. We're going to move on with our next speaker, but you are very welcome to stay with us on the backstage and answer more questions at the end.
Okay.
Our next guest is joining us all the way from Texas, and that is Hollis Wakefield. She is a postpartum doula and registered, I love to say this word, I just learned it, Kangaroula, and she co-teaches a NICU class for birthing advocacy doula training. She provides doula services to support families of all kinds through their hospitalization, bed rest, life in NICU, and transition home. Hollis is equally passionate about working with LGBTQIA+ folks throughout their pregnancies and postpartum. In her work as a doula, Hollis draws upon her own experience of preterm birth at 24 weeks, being hospitalized herself for nearly a month, and navigating a 97-day NICU stay as a cis-queer person with a non-binary spouse. In addition to helping parents advocate in various medical situations, Hollis offers extensive knowledge about exclusive pumping, cloth diapering, plant-based eating, and resilience during and after the NICU. Welcome, Hollis. Thank you so much for joining us here today.
Thank you for having me. It was so wonderful to hear from Doris and Laila. I just kept finding myself nodding enthusiastically, and I could just talk about this all day. So it's wonderful to be here.
I'll hand the floor over to you. You have a presentation to share with us.
I do. Okay. So I'm just going to get going because I have a short amount of time to cover a lot. I know Fabiana wanted me to share about our NICU story also, which is lengthy. So I'm going to try to keep it as short as possible. But it does begin with a diagnosis of cervical cancer for me in 2012, which is important because it left me with a 30% chance of preterm labor after I had my surgery, which was called a trachelectomy. So I always knew I had a high risk for preterm birth, and I always knew I would be delivering by C-section. So I think in some ways we were set up to be a little bit more prepared for the NICU than a lot of families were. We did 2 years of IUI and IVF, became pregnant in 2018. And we were even able to meet with a neonatologist when I started having some early bleeding to help manage our expectations of a micropreemie birth and what that would look like. So my water broke at 24 weeks. We were hospitalized for 5 days, and then my fever spiked, and we had a cesarean birth at 24 weeks, 5 days at a level 3, a birthing hospital with a level 3 NICU. I was hospitalized for a month. I was septic, and I required a hysterectomy 10 days after my cesarean. So I was very sick, while also our daughter Kepley was experiencing her few weeks, also being, of course, very sick. And about 4 weeks after her birth, Kepley had to be transferred to Children's in Dallas, which is a level 4, which is also where my spouse Court works. And she had a PDA ligation at about 4 weeks old also, and she had severe post-PDA syndrome, and that was when she was her sickest. She had a large pneumothorax, 3 chest tubes, and it was a very scary time. And it was also the longest time we went without being able to do Kangaroo Care. I spent about 12 to 14 hours in the NICU every day, and my parental leave ran out halfway through my NICU stay. So I was privileged enough to be able to choose to quit my job and stay in the NICU with Kepley. I did Kangaroo Care as much as possible between pumping full time. And I think if I had had even more information on all of the benefits of Kangaroo Care, I probably would have done it even more. And it's hard in hindsight, right? Like knowing what we know now, I feel like I would have tried even harder to do it more, although I did do quite a bit. We were discharged 11 days before her due date, even after her being so sick. And our providers did say that that was because of us being able to be there so often and doing so much kangaroo care. And my spouse also would do kangaroo care before and after work as much as they could as well. And here are some pictures of us. Kepley is 3 now and doing great. And, you know, as a queer couple in NICU, we did also experience some things that were frustrating, like a lot of gendered language, and like the whiteboard in the NICU had like mom and dad. And so we'd had to cross that out every time we were transferred rooms. The most upsetting thing really happened about a year after discharge, when Kepley, we had to go to the ED for her bilateral inguinal hernias. And the provider doing the intake actually, she asked for proof of, like, she asked my spouse to provide the birth certificate to prove parenthood, which we knew was not actually protocol. And during a time that's so stressful, that was really frustrating and difficult. So we'll move on to the research behind this, the study that's behind this Kangaroula work, right? So the study is called Immediate Kangaroo Mother Care and Survival of Infants with Low Birth Weight. It was published in the New England Journal of Medicine in May 2021, and it was done by Niels Bergman, who's taught the course that I took along with his wife, Jill, who has done this work for many years. The trial was randomized and controlled, including training and equipment. There were over 3,000 low birth weight infants between 2.2 to 4 pounds. The median skin to skin per day in the control group was 1.5 hours, which is more than a lot of NICU families get to begin with. So it was a pretty good base level in the control group. And then the intervention group got 17 hours median. And the median time to initiate skin to skin after birth in the control group was 53 hours. And in the intervention group, it was 1.3 hours. So that was pretty exciting to see too. The intervention group saw a 25% reduction in relative risk of death within 28 days. And the study stopped early because of the substantial evidence that limiting skin to skin in the control group would increase risk of death. And from what I heard, the hospitals that were doing the intervention group continued with that care going forward, which was pretty exciting. So what is a Kangaroula? A Kangaroula provides evidence-based advanced training on optimizing health for newborns and preterm infants. And of course, Kangaroo Care is fantastic for term babies as well. And we advocate for the best interest and rights of the baby as well as the birthing person. Facilitate and support immediate and continuous kangaroo care with the birthing person. I always think of it in the simplest terms as always trying to increase oxytocin and decrease cortisol in every interaction, in every little thing that happens in that room. How can I be increasing oxytocin for the baby and the family and decreasing cortisol? We also protect the birthing person baby dyad and the family unit through latching, nursing, bonding, and evidence-based feeding amounts and schedules. We are taught to position the baby and secure the baby to keep the airway open and to ensure quick and easy accessibility to the baby if needed. And this is especially important, of course, for the sickest preterm babies, as they gain the most benefits from kangaroo care, as seen in this study. And, you know, I understand this firsthand because Court had to wait 8 days to hold Kepley for the first time. I was supposed to hold her that day, and then my fever spiked a little, and they told me I could not because of how sick I was. And then, so I had to wait 12 days in order to hold her for the first time. And so I do understand how hard it can be to wait so long to hold your baby. And there are a lot of barriers right now to doing immediate and continuous skin to skin, right? We have a lack of parental leave, or like mine, a parental leave runs out during your stay. Maybe your leave doesn't pay your full salary, and immediate and continuous kangaroo care can only exist when supported 100% by societal and hospital infrastructures. So I think we need to work on what barriers can we change. Are we charging for parking that's keeping parents from being able to be with their babies? Do they have access to transportation? Do they have good food at the hospital? Are we really putting them as a priority, as the most important people of that baby's care team? Are we facilitating that and not just saying it, but supporting it in all of these ways? And I think it's also important to acknowledge the difficult feelings that may come up if you hear all this information and didn't get support with Kangaroo Care, or you were unable to do Kangaroo Care, and to, you know, hold space for those difficult feelings, but also know that you can start Kangaroo Care. You can do more of it when you get home. You can get those benefits at any time, and for any length of time you can do Kangaroo Care. And there are also other ways to bond in and out of the NICU. So, you know, feel free to reach out to me via email or Instagram, and I'm always happy to help you with other ways to bond with your baby if Kangaroo Care isn't something you can do as often as you would like, or if you can't do it at all. So what is possible? We want to move, as Kangaroulas, we want to help everyone move from thinking about preterm babies as risk reduction and move towards health enhancement and resilience. So I think the gold standard, or what I think of like what would be the most incredible thing, would be to have Kangaroulas in birthing hospitals and NICUs everywhere to fill the gap for the overburdened care teams, to support NICU families, teach them how to do this, and really be spokespeople for Kangaroo Care and educate. And I think it's easy to think, well, what about those earliest micro preemies? Is this even really possible? And one of the most inspiring things I saw during my training was a video taken in New York, and it was a 28-weeker being born, and they were able, because they were all set up ahead of time, everyone knew the plan, they were all trained on how to do this. They did immediate skin to skin at birth, and they had CPAP on this baby within 13 seconds. And the baby regulated very quickly. And, you know, it was pointed out that that was actually a lot faster than if you were waiting to move the baby over to an isolate, get the NICU team started on the baby, and then do CPAP. 13 seconds was incredibly fast, and you still got that skin to skin. And, you know, all the benefits of that. So, and then in Sweden, NICU parents are paid to be with their babies full time in the NICU, which is so inspiring to me. I think that's incredible. And I think there's also, we need to start looking, kind of to what Doris was saying, start looking at the birthing person's body being the best isolate, right? Instead of seeing the isolate as the safest place or the best place, we need to shift to seeing the birthing person's body and the family's body, the partner's body, as the safest, best place for the baby whenever that is possible. Of course, there are times when it is not safe to do Kangaroo Care, and there are other ways, like Doris was talking about, of providing skin to skin and bonding. But whenever possible, and maybe we should start thinking differently about when Kangaroo Care can be done, and stretching that a little bit more, you know. After seeing that video, I was like, wow, that's incredible. I mean, that's just amazing. So that's some of the work that I'm doing. And if you want to know more, you can follow me. And then there are some more, you know, supplemental reading resources that I have as well that are excellent. So yeah.
Wonderful. Hollis, thank you so
Sorry,
much.
I know I flew through that. I was just trying to cover it all.
That is amazing. I'm so grateful that you joined us to share your personal story with preterm birth, but also your training and this new field that is pretty new to me. And I talked to Doris about it, and also it's new to Doris. And it is incredible. I had my heart filled with gratitude that this work is actually being done and really reinforced the importance of kangaroo care. But I have a question here that maybe both of you could answer. It's from Aruna. Thank you, Aruna, for joining us here today. Aruna is a family advisor here at CPBF. Her question is, I wonder how we can support families that have kids at home, need to work, don't have the support to be at the hospital to do full days of kangaroo care. There are so many socioeconomic factors that are barriers to parents being able to be there. And we know, as a matter of fact, this is an issue for many families. And we also know this is a big problem in the US where you don't have extended parental leave. But I would like to hear your thoughts and comments on that. Maybe start with Hollis.
Oh, sure. It's a huge problem. We had parents in our NICU that lived 3 hours away and had other children. Like, how do you make sure those parents are able to be in the NICU? And it's so multifaceted. You know, I think for me, like as a doula, I'm always, part of my job is to just tailor what I can do for families to what they need. So if it is childcare, then that's what I do. But not every family can find a doula to do that. It is, I don't think there's an easy answer. I struggled with this all the time because like I was saying, our society is just not set up to make the NICU family be the center of care, which it should be. They are the most important members of the care team. So I don't have an easy answer for that one, especially here in the States. It's really hard.
Yeah, because you did mention Sweden, and we know Sweden has a 2-year parental leave, and it is a completely different setting altogether.
I mean, it's heartbreaking.
Absolutely. Doris, from your experience on the bedside for so many years, what are your insights and comments on that?
Well, two things I think that need to happen. One is on a societal level, and I had the privilege of being involved in a challenge of our system for paying for maternity benefits. And you know, that's the term that the government gives it. Maternity benefits for babies in the NICU often run out before the baby comes home. And we had a family in our unit who actually did a court challenge and got support for that. And I had the privilege of contributing my thesis work for supporting that. And they actually successfully won that court challenge. And there are new benefits that are in place for families whose baby's in the hospital, so that the employment insurance benefits kick in then later. So that's on a bigger level that needs more support. On a smaller level, we often would take cases one by one and help families to troubleshoot those situations. So we would arrange volunteers to look after the other children, so that the family could bring in the siblings, and we'd have somebody look after them within the children's hospital playroom for a couple of hours or a half day, whatever works for them. We would find ways to get parking passes through our social work department, or our foundation would contribute money. So we built programs that individualized based on the needs that we have within our own situation. And honestly, in Manitoba, we have a high percentage of child poverty. So we know that these families also have a high percentage of premature babies. And so we had a huge challenges, but we would just don't give up, like attack those problems one family at a time. And then as you do that, you start to build programs that affect more families. And then eventually you might find a family who is able to challenge some of the norms in society that really put these barriers in place.
Absolutely. And now you have an extra barrier, which is the restrictions in the NICU during COVID, that you know that volunteers are not there. A lot of the huggers in the NICUs are gone because of the pandemic. And we know what's happening in NICUs around the world. Some still in Canada have very restricted hours. And actually, as a matter of fact, we learned today that one of the NICUs in Ontario only allow one parent for during the NICU stay period. So there is no other parent coming or going from the hospital. So we know we have a lot of advocacy work to do, and we are not giving up because we always want do everything that we can for the best interest of the children and the parents. But I will thank you, Hollis, for joining us live from Dallas today. We are super grateful to have you join your experience with us and your expertise. And Doris, you stay with us because we are going to go to our next guest, who is a father who spent 258 days in the NICU. So Hollis, thank you so much again, and I will see you again soon.
Okay, thanks.
So what am I doing here? Here is Doris. Let me introduce you to Jason. Jason is the father of Sophie, who was born at 23 days and 23 weeks and 3 days. Let me bring his picture here. And 3 days gestation in 2017. She spent a total of 258 days in the hospital. Jason and his wife, Andrea, did Kangaroo Care almost every single day. And let me bring Jason up here. They were the hospital that really pushes families to do Kangaroo Care. And they started when Sophie was only 2 days old and 1.5 pounds. Jason could do Kangaroo Care even when Sophie was on multiple types of ventilation, including the jet ventilation, where many hospitals don't allow it. Sophie had a long, complicated hospitalization with a total of 6 surgeries. She's now 4 years old and thriving. Jason, thank you so much for joining us here today, live, I believe, from Newfoundland. We are so grateful to bring a dad's perspective to this conversation today.
Hi, thank you for having me. Yes, we're in Newfoundland, but Sophie was actually born in Alberta. So we were lucky. Alberta has a really good NICU program, and they really push Kangaroo Care. So that was one of the factors in us being able to do Kangaroo Care just about every day.
Jason, I will let you share your slides, and then we are going to address questions at the end of your presentation.
Sure. So like you had said, Sophie was born in July of 2017, 23 weeks, 3 days gestation. She was 695 grams, so just about 1.5 pounds. So these pictures are from her first day of life. The one on the right is like just minutes after she was born and then intubated. And right away they were pushing me. Pushing me to get hands-on and help even then, which is at that time way out of my comfort zone. But they really encourage you to get involved. And that hospital, this is the Royal Alex Hospital in Edmonton. They really push integrated families and getting the family involved in NIDCAP care. So her hospitalization, was 258 days. So it was about 7 months in intensive care in the NICU, and then another 2 months in the rehabilitation ward for gastrointestinal and heart issues. She was there for the gastrointestinal part. So she had six surgeries. 4 of them were gastrointestinal surgeries, and then she had PDA ligation for her heart and retinopathy prematurity, so she had a laser eye surgery as well as Avastin injections the month before. She developed neck sometime in the first week of life. It went undiagnosed, I guess, until about 6 weeks when she had her first surgery. In the neck, she had actually had several abscesses that formed on her lower intestine that had ruptured. So they were expecting a small perforation and a relatively easy surgery. The surgeon actually put it off towards the end of the day, said there are sicker babies that we're going to get to first, and then we'll get to her. And then when they started the surgery, she became extremely unstable and her blood pressure really dropped. And it took, the surgery was hours longer than they expected. And they called people from the NICU to come, like the nurse practitioners and the charge nurses and everything, to come sort of assist. And anyway, they were able to stabilize her, and they weren't sure how she was going to do that night, if she was going to make it through the night. And then she had started to do better already by early that morning. But it was a very, very traumatic day, very difficult day. And then it changed our outlook. At the time, they were saying you could expect to be discharged around her due date, which would have been on Halloween. And then at that point, they said, you need to rethink this. We're looking more at like a year before this, like this is going to be a long road. So we didn't actually live in Edmonton, so we had to sort of rearrange our whole life. But basically, yeah, she ended up being in there for 9 months, which is less than they originally said after her surgery. But the first 5 or 6 months were a very long, sort of difficult road. She had 4 intestinal surgeries because the first time that they reconnected everything, her reanastomosis surgery failed after about 11 days and ruptured. And then she had to go for emergency surgery. And then her 4th one after that, they waited several months to reconnect it. And then from that point on, it was kind of like all uphill. She really took off. I have a slide here just about NIDCAP, because NIDCAP's newborn individualized development care and assessment. And it's pushed a lot at the hospital where Sophie was. They really focus on it. And I have this basically because mostly at the bottom there, it shows, so these positive environments like the mother's womb, the breast and body, and the family social group are replaced with negative things that have like long-term impacts on the child's development, like incubators, parent separation, painful touches, and many hands. And those are the areas that we really chose to focus on and reduce as much as we could. You can't reduce them 100%. But we were fortunate enough to be in a position where we could be there just about every day. It was like 4 days throughout the whole time where I wasn't there, where I had gotten sick. This was before the pandemic, so it was different in terms of that. But we were planning to move to a new career and a new province, so we had prepared to have like income to last us for about a year. So we were fortunate in that aspect where we could be there every day. We lived 4 or 5 hours away from the hospital, and I know like one of Sophie's roommates, they were also from Fort McMurray, and they could only come on the weekends. So it was really sad that some people are in that situation. We were fortunate enough that we were there. We rented an apartment right next to the hospital. So, but anyway, Kangaroo Care kind of tackles all those negative impacts. You kind of get all of them at once. She's out of the isolate. They're with the parents. It's not painful, it's soothing. And we could actually get some of the interventions like blood work and things done during Kangaroo Care. So we did Kangaroo Care for the first time when she was 2 days old, like less than 48 hours old. And they really pressured us to do it. And we were, and I say that in a good way, like we were nervous and did not think that the pros could outweigh the risk at the time. And they explained it. They spent a lot of time explaining it to us, especially, so Dr. Jules Tipgun, he's Canada's first NIDCAP trainer. And in this hospital where he works at, the Royal Alexandria, is the only NIDCAP training institute in Canada. It was at the time. I think it still is. I'm not 100% on that. But he was the neonatologist when Sophie was born. So he was the first neonatologist to get her sort of set up in the NICU and talk to us about everything. So I think we didn't realize until down the road exactly how beneficial it was having him as a resource. But he's a big part of the reason, obviously, why that hospital really pushed it, and they really encouraged you to hold. And they were in the process of changing their whole like a intake program, a little video for parents to watch when they're new to the NICU about how to be involved, how to advocate. And we're actually, I think we're in the video. We're not talking in it, but there's pictures of us and Sophie in there. So then. Yeah, we did Kangaroo Care almost every day. There were some days when we couldn't. So after surgeries, when she would be really unstable for a little while, right before her first surgery, she started to get really unstable. If you just touch her like she would brad, and even asystole sometimes, like the heart rate would just drop. So we still tried to at times, and there were just some days that we couldn't, but we still would help every way we can. We would have hands on and just read to her so she could hear our voice for like hours a day. And then here on the left, Sophie's actually getting a PICC line put in. She had 3 or 4 PICC lines, like she had little paddles on like every hand, and IVs in the head. And so there's a lot of traumatic interventions. So then that's my wife, Andrea, still holding her. We weren't legally allowed to do the PICC lines, or we probably would have. We did everything that we legally were allowed to do, including like her ostomy changes. It was in the nursing notes. Parents do the ostomy changes. We changed when they would weigh her so that they're not just waking her up and putting her on a cold scale. We would do it when we're up with her and just write it on the whiteboard. So they were really accommodating, let us do a lot of the care, anything other than IV and line care, obviously. But Andrew's holding her and talking to her, soothing her during like a PICC line. So just to try to make it a little less traumatic. And same thing in the bottom right there, that's a nurse and Andrea. So there's the nurses. Anytime the nurses were doing anything with her, we would try to get our hands on her and just try to soothe her. And even holding her, the smallest soother they have is too big, especially with the IV, with the intubation tube. So we actually cut it so it would fit around and just hold it there for her because she couldn't keep it in her mouth. So just little different ways outside of Kangaroo Care that we could help. And then we would do Kangaroo Care just about every day. And this shows so the first 2 pictures here are jet ventilation, which even this hospital had only started doing jet ventilation within a year during K-Care, allowing K-Care. So because of the resources that are required, it took a couple respiratory therapists, a couple nurses, and you can see there's a big pump there on the chair that's like taped down. And it was a real process to get everything in place so that you don't want the pump to fall off and yank on, all the lines and everything. And then we did it with nasal cannula and regular intubation, and then there's high flow there. So no matter what sort of ventilation, some hospitals have restrictions, and it's really good that we were at a hospital that has no restrictions there. And then, yes, so we're also always helping whenever we could. Another benefit to the Kangaroo Care, especially the chair, if the chair can really recline a lot, for a long time, it was Sophie's only opportunity to try to do tummy time and strengthen that neck. Early on, she was still too small, but in the third picture there, she's a little closer to discharge and able to start to lift her head. And yeah, we just always, if we couldn't do K-Care, hands would be there reading. We were there as much as possible, really, especially when she went to the rehabilitation ward. We didn't leave the hospital for 2 months, except I had to go take care of my dogs every now and then, but we lived next to her bed for 2 months. And then here you see she's getting OIT during K-Care while on jet ventilation. In that center picture, the green tube there, you can see that she's on the jet ventilator. So and then so the Royal Alexandra Hospital, they give us Kangaroo Care shirts, and that's what's in most of these kangaroo pictures. That's what it's showing. It's showing they give us that, and it velcros up, so you situate the baby there, and then you can cover them up and keeps them nice and secure and warm, and they can stay there a long time. We each got them. I know sometimes dads have said they feel like they don't have a place in the NICU, and I can't really comment on it because I didn't have that experience at all. They gave me my own one for K-Care right away. Like Andrea did K-Care the first time, and then we sort of alternated after that. So I did it on the 3rd day of Sophie's life, and we just each had our own one the entire duration of her stay, and even going back and forth between different hospitals because she had to go to a different hospital, the Stollery Hospital, to get her surgeries. And then this is after, just to show after her final surgery. These pictures are all 6-day intervals where she was having a really hard time gaining weight. And then she finally started to gain weight and finally started to get weaned off of TPN and started to get more and more breast milk. Because for a very long time, basically 7 months, she wasn't getting any milk, a little bit of OIT, a couple mils a day, just that's not even making it to her intestine because she had ostomies. So this was a really big moment for us when the the surgeon like literally at this point said, give her. He's like, it's not going to harm her at this point. So that's when we can give her as much milk as we want. Like that was just before, pretty close to discharge. You can see it's 236 days. So that's as we were getting ready to leave. And then this is Sophie today. So she'll be 5 in July. And aside from her eyes, which she needs glasses, but other than that, she doesn't have any long-term complications, and she's not on any medicines, and she went home without any oxygen, without TPN. These are all things they told us we can expect to go home on oxygen, expect to go home with TPN, and then she really started to get off it fast. They kept saying it's not a race, this is a marathon, and then they just kept, she's doing great, she's doing good, you're going home soon. I was like, okay. It really started to pick up. So I do credit the amount that they allowed us to be involved as a factor there. I mean, we're not able to quantify that, but I don't have any question that it played a role in her recovering so well from some of these things. And even there was one day when her kidneys were failing and her potassium had spiked really high, and they basically said, this was at like 4 a.m. when she was in Nicu, so we weren't there. They said, you need to come in, and you're probably time to say goodbye. And so at that point, there wasn't anything we could do. We're just watching the monitor, waiting for her heart rhythm to change because the potassium starts to affect her, and then it's kind of downhill from there. And then Andrea they just said, well, we just held her and did K-Care like the whole day, basically. And then that night, then her kidneys started working again. She hadn't peed in a couple days, and she was only 2 pounds at the time, 2.5 pounds roughly, and gained a whole pound in water weight in 3 days, I think. So like 50% of her body weight gained in 3 days because she had stopped peeing. And that night, it just opened up, and she was just nonstop peeing. So it was really a happy moment for us, and like we feel like the K-Care, that is all we could do. Sometimes you feel like you can't help and you're hopeless just watching this monitor. So that's when when Andrea just did K-Care for, I don't know, 5 or 6 hours straight. I forget now exactly how long it was, but and then now, so the road was really tough, but now she's doing great, and she's happy, always smiling. And she's starting to understand a little bit about what we went through. I made a video at her 1 year mark, and she loves to watch it all the time. So yeah, that's our story, and it's good to see people pushing for the Kangaroo Care and seeing it become more of a conversation, because I've seen at the time when Sophie's in the hospital, a lot of people were saying, when did you get to hold your baby? Like, my baby's 4 months old and I haven't been able to hold yet because she's intubated. And I just think that's really sad to see and hear that people are still struggling with that when the information's there.
Absolutely. Jason, thank you so much for sharing your story. Honestly, it brought me to tears because your story brings a lot of memories for me as a preemie parent. And I'm in awe of your strength. It was a very, very long NICU journey. And I think I would like you to share with parents and healthcare professionals what held both of you together in the ICU for all those 9 months, because this is a very lengthy stay in the NICU.
Like I mentioned, we were in a sort of a unique situation where, like, I had already quit my job because we were supposed to move from Alberta to British Columbia, and I had bought a company that I was going to start a completely new industry, and that just all went on hold, and we never ended up moving to BC because she was born there. And she was actually my wife's water. God's getting excited. My wife's water broke in Fort McMurray, and they don't have the resources there, so they said you have to go to Edmonton. So it's a 4 or 5 hour drive. So we went there and just stayed in a Ronald McDonald house until we eventually rented. When they said it was going to be a year, then we eventually rented an apartment. But so we were just there. Like, my wife's maternity leave, a little different than what they were talking about in the States there. Like, her maternity leave didn't even start until, in Canada anyway, until the due date. So it was like not just maternity leave the first 4 months, but it was like Andrew's full pay. And then the maternity leave for special situations like this, it's not a certain amount of time. It can be prolonged as long as the child is still in the hospital. So that as well as we had saved money to switch industries and to live off for a while, we were able to both be there, both support each other, and the hospital staff itself was really good and really supportive in letting us do a lot of the care ourselves. I think that really helped. We felt like we had a purpose, and we advocated a lot. Sometimes it involved having meetings and disagreements, even like with like some of the doctors and staff. And we would have meetings with like social workers and then the nurse practitioners and the charge nurses whenever we had an issue, and they really would sit down and take time out of the day and address any concerns that we had and explain things if maybe we didn't understand it. So they were a big help too, especially we had certain like primary nurses. I know Laila briefly mentioned like a primary nurse. So we had that as you go, and nurses that you get comfortable with, you just make them your primary, and they'll try to schedule those nurses for you. So it's really nice when you know that nurses that you know well are going to be caring like for your child that evening. You can kind of relax a little bit maybe at times.
Absolutely. So Doris, any question for Jason? And I'm also going to bring here our previous speaker who is holding Farah, who is 10 months old today.
Well, I just actually wanted to make one comment. In my career, I've seen babies who died from overhandling, negative handling, negative touch. But I've also seen babies whose lives were saved by positive handling. And I think, Jason, when you described that day when you were there to potentially say goodbye to Sophie, like you saved her life with your positive touch. And that probably brings a lot of people to tears because it's really true. And it's happened more times than you can count. And I think that you saved her life so that she could save yours as you go on. And you know what, those beautiful pictures, they just say it all. Like the difference in brain development in Kangaroo Care just is overwhelming when you see these kids who are so brilliant. And it's a wonderful thing. And I think you told a really, really good story. So thank you very much, all of you. All the parents are just amazing. And I think it's great having Hollis's perspective to remind us, you know, that we need to individualize everything, the family, the specific care. And I think I encourage parents to just keep chipping at it, reminding us to individualize, to customize, to make everybody feel like they're important, because honestly, the parents, the family, everything is more important really than the caregivers in a lot of situations. So it's a teamwork. It's a team, but so thanks.
Absolutely. Wow. Thank you. I think Doris, Jason had already brought us in tears. You made all of us cry. I brought Hollis back because it is, as the Nicu parents, I think we can all relate to those moments in the ICU. And I'm so grateful to have all of you here today, actually, sharing your stories. Our stories, as hard as they were for us at that time, it inspire other families to continue their journey, because many families are still there. And I think it's also a way for us to show healthcare professionals how far we can go as parents in the care of our babies and how resilient we all are. And now we can inspire others to continue their journey. So I will thank you, all of you, for joining us here today to help us to raise awareness about Kangaroo Care. May 15th is Kangaroo Care Day. And as Leah mentioned, Leah had to leave. But we just launched a new infographic with information for Kangaroo Care, and everyone can download from our website and share in the ICU with the families. So thank you, everyone, for being here with us today. Thank you, Doris, Hollis, Laila, and Jason. Thank you so much.
Thank you.
Thanks.
Thank you.
And to all of you watching us live here today, Thank you. I have a picture of Sophie here. So thank you so much for watching us live here today. It was an emotional session for all of us. The video of today's session and all the videos from our live series are available on our website, which is the canadianpreemies.org. And I want to thank our sponsor, AstraZeneca and Water Wipes, for their ongoing support to our educational program. And we are a charitable organization, and we believe that through support and education, we can empower families, ensure they are ready to care for their babies. Please visit our website, consider making a donation. Together, we can create a brighter future for all our families. And I will see you again next Friday, 1 p.m. Eastern Time. Stay well.